If you were in Australia, we would say good day. So good day. So can we all say good day? That's much better. Right. Healthcare and healthcare IT are things that today are far more important than ever before. We've seen around the world unprecedented debate following the global financial crisis concerning healthcare. The debate that is penetrating America and in part tearing America apart at the moment at its foundation is about what healthcare system is going to be able to sustain the American environment in the next 20, 40, 50 years. Here in the United Kingdom, you only have to look at the papers, and there's probably not one day that goes by where the healthcare system or the debate doesn't surface quite strongly. And it's so on around Europe, Asia, Middle East, Australia, New Zealand. That debate is echoing and reverberating around the world. And why is that? It's because, firstly, we are facing enormous challenges in relation to healthcare. We've got growing population. Already, I actually read an article in the Times this morning how the population is expected to increase over the next few years in the United Kingdom by 10 million people. Australia is expected to double its population. That goes from 5 to 10 people. No, actually. It goes to up to 50 million people in the next 20 years or 25 years. Not only do these challenges place enormous burdens on our social infrastructure and particularly healthcare, but it actually exacerbates the problems that are already prevalent in our healthcare system today. These challenges and these problems are familiar to many of you, but they include the lack of changes that we've made to the way healthcare is delivered. I actually had an interesting conversation with the Dean of the Medical Faculty of the University of New South Wales, one of our leading healthcare teaching institutions in Australia. And he said that he today could go to one of the leading teaching hospitals in Sydney, and he hasn't practiced medicine for 30 years, and he could walk in there and he could practice medicine today as though he did 30 years ago without much change, which is quite astounding, really, when you think about it. Quite dramatic, because genomics has changed, the development of the pharma industry has changed, the innovations in terms of the technology the doctors use has enormously changed, but the practice of medicine has not kept apace. It has not changed. And it was for these reasons that we felt that we needed to do something to start this debate in a far more aggressive and a far more dynamic way and to get ahead of the curve. 6 years ago, our company was the leader in innovation by introducing what was then the most transformational product of its kind around the world, Lorenzo. It was the reason we were chosen as part of this country's largest national program for healthcare innovation to actually deliver the Lorenzo solution for more than 60% at the time of the country's population, because Lorenzo was going to be an innovative solution. And while 6 years have passed and we are still delivering Lorenzo, part of the problem is that that has become a project of delivery rather than a project of innovation. And we believe that we owe it not only to ourselves, our customers, and our partners globally, that we need to be ahead of that curve. We need to be taking the debate to our customers, to the government. We need to be saying that innovation and innovation in relation to healthcare is important as it was 6 years ago, but perhaps more important than ever. And so we just started this discussion. Topics such as genomics, semantic interoperability, user-machine interface, all very important topics that we found, and others were very important things that we believe needed discussion, because it was the only way we felt that healthcare was going to get a better take-up, a better user acceptance by the healthcare community around the world. And so with that debate, we actually asked our Chief Medical Officer, Dr. Michael Dowie, who we'll introduce you to soon, to actually lead a specific area of innovation across the company. So we started to introduce not only innovative things in the company and about the way we operated, we also started delivering and bringing out tools such as our Blue Ocean, as our Health Studio product, some of which you hopefully have the opportunity of seeing out in the foyer, or in relation to some of the concepts such as the Medical Advisory Board, which is a group of clinicians at an international level which will work with us globally to actually give us input about what the clinical world is saying and what we can do in terms of taking up their advice. But we also thought that we needed to do more. And with that, we created Ideaworks. But Ideaworks we couldn't do alone. Ideaworks is no more than a concept that we believe was an interaction between you, our customers, our partners, our friends, and colleagues, for which we can together participate and share and actually grow in terms of understanding the innovative concepts that we're talking about today. It's a physical presentation, as you will see, hopefully many colours, themes, all of which are meant to provoke excitement and your interaction today. And to that, I think we have to say that the organisers and Susie and Michael have done a fantastic job, so you've got to give them, we should give them a big hand. But I hope that the vibrancy and the colours about what we've got today are symbolic of what we're going to get out of today. Because what we're trying to do is actually get you to help us lead that innovation, not only in the physical presence of today, but on the online world for which today we're launching the Ideaworksforhealthcare.com website, which will become a virtual world of innovation over many weeks, months, and years ahead. And I'm going to encourage you, your colleagues, and our friends on a global stage today to actually start participating on that innovative website that will actually lead to us getting better feedback, more information that we can help drive and deliver healthcare innovation more effectively. And that really is what today begins about, what today is about. It's the beginning of this journey. It's the beginning of us listening and becoming more focused around what we believe the healthcare community globally needs. And why we wanted to get you involved is to be far more interactive, for us to listen. Where possible, we'll take these on. But whether we do or don't take these on, it's really not so much relevant as the journey itself. Because it's that journey where innovation will hopefully come more mainstream into the way we and the way you work. I hope you find today exciting. I hope that you start participating and being very active and proactive in what you do with us. And more importantly, and perhaps the essence of what I would like to achieve today, is for you to have a lot of fun. Have a great time. Thank you very much.